Hi, this is a seniors and also a back care session, and the equipment that you can use in this session, you don't have to have it, is a soft ball, and again if you haven't got one don't worry, you can always use a cushion, a circle, and again if you haven't got one don't worry, you can always use a cushion, and a band. And we need a mat as always because it's a floor based session, and in the event that you've got sore knees then again a cushion or one of our pads, either of those things will do. So we're going to start on the floor and stay on the floor, so it is a completely floor based session. So I'll see you down there. We're starting in all fours, and because all fours can be an uncomfortable position for a lot of people's wrists, we are going to start with some wrist mobility and some warm-ups for your wrists. And I find these are very useful. I do a lot of rock climbing and that my wrists get very sore, and that if I do these first they don't. So if that helps you, we're going to start with the hands under the shoulders, knees under the hips, hands shoulder width apart, and just have a little rock backwards and forwards. So as you rock backwards and forwards, we're just increasing the range of the movement at your wrist, but I want you to be conscious that you don't exceed your comfortable range of movement. So again, coming as far forward as you can in terms of bringing the forearms towards a vertical position, but not trying to go further than that. And if your wrists do happen to be uncomfortable, then again a cushion, a pad like this one, or a slim book will do the job. You just put the heels of your hands on there and that'll just take a little bit of the pressure off your wrists. Equally, if your knees are uncomfortable, put a pad underneath your knees. So you might need two pads. So, coming back towards this all fours position, I'm going to rotate my forearms, and for me, because I've got hypermobile elbows, they go right in that direction. I don't want that to be my working position, and if I go the other way I don't want that to be my working position, but I am for now actually going through that range, not forcing it into hyperextension, but going through that range because I'm getting some movement in the wrist and in the shoulder and in the radial ulnar joint, so there's a lot going on there. And then again, come back to a neutral position. What I consider to be neutral in this position is the crease of my elbow facing in towards the other arm. And again in that position, come slightly back, so my bottom is further back than my knees, so I've got less weight on my hands, and I'm going to lift the heels of my hands there. So warming through the wrists and through the joint where the palm meets the fingers, if you like. And then release the palms down, come back into that close to vertical position, relax the elbows, and then be aware that your wrists and forearms are not inert. You've not just got pressure pushing down there. We're going to press into the fingerprints. Imagine the palm of your hand like a suction cup, and have some activity in the muscles of the forearm supporting your hands a little bit as well. So again, if that's uncomfortable, come back a little bit further. We're going to shrug and release the shoulders. Be aware that that movement's not affecting your neck, and that essentially your spine from the tailbone to your head is in a long horizontal line. So we shrug and draw down, so I've got that sensation of pulling my armpit down the side of my rib cage. And this time I'm going to draw down and I'm going to push the floor away, and as I come down just be aware that I'm not doing a press up, I'm not bending my elbows, I'm actually separating the shoulder blades and squeezing them together. And equally, I'm not poking the chin forward and bringing my head down, I'm actually bringing my chest down. So again, I don't want to be in either of these extremes, same as with the elbows. I want to find some middle ground where I'm pushing slightly away, but I'm not flexing the thoracic spine, and those shoulder blades sit nice and strong on the back of the rib cage. So this time I'm going to rock back. This time my focus is on knees and hips. If your feet are not comfortable with the toes tucked under, then point the toes away, and equally you can put a rolled up mat or a towel or a pillow underneath your ankles if that gives you a little bit more comfort. If your knees are not comfy, don't go so far back, and just very gently loosen through the knees and the hips. Now coming forward again into that all fours position and release the lumbar spine. So hopefully you can see from there that what I'm not doing is flexing through the thoracic spine. I'm actually trying to keep my thoracic spine still. and I'm moving the lumbar spine. So I'm moving the pelvis on the femurs, tucking the tailbone under, tilting the pelvis back, flattening the lumbar spine, and then rocking the pelvis forward, pointing the tailbone up, and extending the lumbar spine. If either of those is uncomfortable for you, make it smaller. Remember, you don't have to go for a big range of movement. Just that gentle, dynamic movement is going to help lubricate those joints. So, giving your wrists a breather, because we've been on all fours for quite a long time, we're coming up into a kneeling position. So in that kneeling position, knees hip distance, feet slightly apart. Think about a vertical line from the hip bone through the head of the femur, through the hip joint, and into the knee joint. So I've got that vertical line. I want the same continuous vertical line coming up to my shoulders. And in this position, there's often a temptation to move into a bow shape and push the belly out. So I'm going to pull the tummy in, tuck that tailbone under, stack the ribs above the hips. And here, in this position, lengthen through the crown of your head, just gently roll those shoulders for me. So if I come round to face you, as you squeeze the shoulders back and down, we get wider across the collarbones, wider across the chest. Those little fingers come inwards, the thumbs turn outwards, and I'm pressing my fingertips down towards the floor. So again, one more time, and coming back into this position, and we're coming back down onto all fours. From here, think about looking at yourself from above. So you're looking at your spine, a long straight line from the crown of your head, sorry, the back of your head to your tailbone. Now keep from the base of the rib cage to the crown of your head still, and we're going to move the lumbar spine. If you can imagine, again, it's kind of like a J shape as it goes down and then flicks up at the bottom, but we're laterally flexing the lumbar spine as we hitch first the right hip and then the left hip. So if I show you that from behind, you can imagine I'm in all fours, I'm drawing one hip up and then drawing the other hip up. So I decrease the distance between the ribs and the hips on my right and decrease the distance between the ribs and the hips on my left. What I'm not doing is looking round towards my tailbone. So keep that upper back nice and still, head and neck nice and still. And be aware that your femurs aren't swaying from side to side either. So that's more isolated into the spine. There's a little bit of movement in your hips, but not much. So we're going to finish on your left side, and again come up into that all fours position. Still now with lateral flexion, hands down by the side of your body, and gently slide from side to side. So this is where these pads come in very handy if your knees are a little bit tender. And again, you can kneel on as many as you like, just bear in mind that the more you have, the less stable you're going to be. So sliding gently from side to side, imagine you're trapped between two panes of glass. And whilst we're here, just circle your wrists for me. And as you circle your wrists, we're just loosening any tension in the wrist joints. Can we go the other way? And if you can look at your wrists and just make sure they're both doing the same thing, going through the same range, as close as you comfortably can, and then come back and just imagine you're revving up your motorbike there, flex and extend the wrists. So we're going that way and that way. Lovely, and then spread out your fingers, claw them up. Lovely, so you get a bit of a stretch down the back of the forearm there as well. Lift them up and pull them down. Well done, and then palms together, prayer position, shoulders down, elbows down, and just press the wrist down. So for me, that's coming towards a horizontal position. And again, not to discomfort, try not to let the heels of your hands come away. And same thing in reverse. Again, if it's not comfortable, don't force it. You might want to keep a little space here. But if you can imagine that V, I'm closing the top of the V. I don't want to shrug the shoulders and lift the elbows. So shoulders down, elbows down. And imagine you were just bringing the little fingers together and your thumbs together. So again, that's fairly kind of passive, but it shouldn't be uncomfortable. So stay within a range that feels comfortable to you. The reason we've done that is because we're going back into all fours again. Promise we'll be done with all fours soon. So again, hands shoulder width, knees hip width, spread out those fingers, press into the fingerprints. Relax the elbows, push the floor away, lengthen the neck, take a breath in. As you breathe out, think about making your waist smaller inside the waistband. Keep those elbows relaxed. Can you take your right hand off the floor. Inhale, release. Exhale, take your left hand off the floor. Inhale, release. Now what's really important, hopefully you can see it in my demonstration as you're joining me, is that as we take that hand off the floor, the other shoulder doesn't shift, it doesn't sink, and that the collarbones stay horizontal, and that the elbow doesn't lock. Yeah, so keep those elbows nice and soft. You'll feel work around the midsection as those spinal stabilizers work to keep you nice and still. The abdominals, deep abdominals switching on. Now what you'll also find is that you will cheat. So when you take your hand off the floor, the tendency is to pull back and we come forward. And again, only as far as your wrist is comfortable. Reset your position. Take the hand away. Can you come forward? One more on each side. If your wrists are tired, rest. Hand away. And hand away. So we're going to pull back into shell stretch, turn the palms up to the ceiling and flex and extend the wrists. So again, just releasing any lactic acid there and just lubricating those joints, getting rid of any tension. If your knees are uncomfortable, remember you can keep your bottom up in the air and do the same thing. Now in this position, just rest here or as close to this as you can comfortably get and take a wide breath in. And breathe out. I want you to be aware that as you do that, you don't shrug your shoulders. So we're drawing those armpits down. Keep the neck relaxed. You're not trying to get your head down onto the floor. Keep it slightly lifted if that's more comfortable. And again, we're trying to avoid a lot of thoracic flexion. So if you are quite flexed in your thoracic spine anyway, stay up here. And another option is to place the fists one on top of the other like that. And just rest your forehead on your hands. So again, you're slightly supported in that position. So we're taking a breath and we're expanding the ribcage laterally and posteriorly. A gentle breath, not a great big gasping breath. I'm breathing audibly so that you can hear me, but you don't have to. And imagine yourself like a loaf of bread rising. And shrink. Feel the ribs get closer together. Breathe in, expand. Feel the ribs get further apart. Now we're going to come down in our next position onto your front. So as we come onto your front, we want to have a little bit of space in front of us, which the way I've organised it, I haven't got. So I'm going to come a little bit further back. If your back is uncomfortable when you lay on the floor, remember you could stay seated if you want to, or you can place a cushion, possibly something thicker than this, under your tummy just to give you a little bit of support. But after all that spine mobility we've just done, hopefully you'll be a little bit more comfortable. So I'm going to position this so it's under my pubic bone because that's a bit more comfortable for me. And I'm coming into a W position. And all I'm going to do to start with is mobilise these shoulders. I want to make sure I've got lots of space. And I'm not taking my hand directly forward. I'm not bringing my arm next to my ear. I'm just going out to 45 degrees and then coming back. Yeah, so my hand goes to 45 degrees, more or less in line with the front corner of my mat maybe, if I was a bit further forward. And come back. And come out 45 degrees. So now let's think about keeping the shoulders away from the ears. And the elbow might lift off the floor a little bit, but as you come back, the elbow goes down. And can we think about drawing the armpits down the side of the ribcage? And we're trying to actually keep the armpit drawn down as we slide that hand forward. So, you can inhale and exhale, draw back. Elbow comes back down on the floor. And again, I'm not pulling my elbow in closer to the side of my body. I'm not lifting my elbow off the mat, or sorry, off the floor. But I am drawing the armpit down. You might feel longer down the side of the neck. Keep that chin tucked in. Inhale and exhale. Inhale and exhale. So think about the bottom angle of your shoulder blade, the pointy bit at the bottom. As you draw your elbow back, it's kind of mirroring that shoulder blade. And draw the elbow and the shoulder blade down. And draw down. Now can you imagine you're pressing your elbow back? And pressing the elbow back. Fantastic. One more on each side. Keeping the neck long, keeping the shoulders still, keeping the head central. And relax. I've got my toes together, heels apart, you can't see them. But I'm going to bring my fingertips under my forehead. Draw those armpits down again, just as we did in the last movement. Take a breath. As you breathe out, connect the abdominals, float the face. And sink back down. And again, armpits down. Now, I want this movement, for me, I've got quite a lot of thoracic extension, so I can come up to about here without my lumbar spine starting to move. I would like you to keep your lumbar spine still as you extend the thoracic spine. So draw those armpits down, float the face away, and release back down. So we draw down, inhale, float up, excuse me, and exhale, release. And draw down, inhale, float up. Keep that neck really long, so hopefully you can see that there's no crease in the back of my neck. And that my lower body isn't moving, my lower back isn't moving. And you can't see, but I can tell you that I'm not pressing into my forearms. They stay completely relaxed. Remember, if at any point your lower back gets uncomfortable, just pull back into shell stretch and have a rest. So, one more time. And what we're going to do is come onto our side. So what I'm going to do is take the arm closest to the wall forward. Now if your shoulder doesn't do that, don't worry, don't force it. And bring my hand backwards and roll onto one side so that I'm in my side lying position. But I'm going to come a little bit further up the mat so you can see where my feet are. And again, as I'm on my side, body should be in a straight line. So I've got my feet flexed and I've got my arm extended. If that's not comfortable for you, remember, bring that arm forward. Don't bring the shoulder forward, and you can use a cushion or a ball or anything else there just to support your head if that's comfortable for you, and if you don't need it, don't worry. So here we are, a nice straight line. With the feet flexed, with the shoulders stacked, so there's a temptation to lean forward and to roll forward, so stack up the hips, stack up the shoulders. You can leave your fingers in front of you on the floor, or you can challenge your balance here with your arm on the side of your body, and if you start to wobble, just pop your fingers back down again. So we're going to do a hip hitch. So I'm going to drop and push away, and if you watch my bottom foot, you can see that bottom leg, sorry, that's my top foot, not my bottom foot. If you watch my top foot, you can see that top leg getting shorter and longer, but just be conscious that I'm not bending my knee to do that. The movement's coming from my hip. So hitch and push and hitch. And you can't see because I've got too many clothes on, but under here, I've got a hollow developing underneath my waist. So reach and draw back. Lovely. So this time reach away, point, lift horizontal, flex and lower back down. Now, as well as working the outer thigh, I'm working on stability in a lateral position. So just be conscious that your front leg hasn't migrated forwards, your body hasn't migrated forwards to make you feel more stable. And that this top hip is staying above the bottom hip. What's not happening is I'm not lifting that leg right up and drawing my hip up towards the ribs. So I'm keeping some stability. So I can feel that working here because legs are heavy. Mine certainly are. And 3, and 2, and 1. Now you may also notice that I've got a pad underneath this hip here. So if your hip is uncomfortable, that's an option, pad or a cushion. And equally, if you're just uncomfortable on your side, remember you can come over onto your back. So this next exercise is a variation that we've just started doing recently. And what I'm going to do is place the circle, but it could just as easily be the ball, in front of my hip and put the top knee on top of it. Bottom leg is straight, but it can be bent if that makes it easier for you. Don't allow the hip to hitch, push the hip away. Top grip is above the bottom grip. Shin is roughly horizontal, waist is hollowed, tummy drawn in. And as I exhale, I'm just going to lightly press. Now, I would expect if I was doing this exercise lying on my back and I had the circle between both thighs, that I would get quite a big range of movement. That's not going to happen, at least not for me, in this position. So we breathe in, breathe out, and breathe in. Now as you breathe out, make the waist smaller inside the waistband. And again, so not only are we working the adductor brevis on the inner thigh, but we're also working the deep abdominals, and we're also working the pelvic floor. And press, so keep the top grip above the bottom grip, and 3 more. Try not to develop tension in your neck and your shoulder, and again, if you are, just draw that shoulder back and down. And last one now, take the circle away for now, bring the knees together. Knees at 90 degrees, hips are stacked, both feet are stacked, knees are stacked, neck is nice and long, and I'm going to lift in a horizontal position. Lift and lower, lovely. So this hip is already a bit tired. If you find that yours is too tired, just stop and have a rest. You can either miss a couple of reps or just stop there. And we have 4 and 3 and 2. Now if you're not too tired, we're going to hold it, and from a bent position into an extended position. Now the spine and the pelvis don't move. Breathing out. So we've got trunk stability, hip flexors working, abductors working, glutes, abductors are also glutes, pushing that leg away. Push your heel away. Keep your waist lifted for 4, shoulders stacked for 3 and 2 and 1, and then bring that leg across. Now if you have a hip replacement, pop something, cushion, ball, whatever, between your knees, just rest there. If you don't, bring that knee across. And if you're comfortable, you can have a little stretch there. Top shoulder goes back, top hip comes forward, knee comes across. And bring the knees back together. Can we come up into all fours? And again, in that all fours position, just release your lower back. Now I'm going to come onto my back. So, as we come down, again, if you want something underneath your head, we've got a pad or a cushion. If you don't need anything, that's fine. Remember that rolling backwards is not a very comfy thing to do for your back, particularly if you've got a back problem. So bring your knees together, come down onto your side. With your knees together, tummy pulled in, come round onto your back. And if, as you're lying on your back, your chin is poking up and you're looking at the ceiling behind you, remember that means you need A, to tuck your chin in, and B, to put something under your head. Not too thick, because we don't want to push that head forward. So in this position, knees are bent, 90 degrees, trousers are up, in a neutral spine position, and my shoulders are away from my ears, so those armpits are pulling down the side of the rib cage. I'm wide across the collarbones, but just be conscious that if you're quite tight here and your shoulders are lifted, that as you press them down, you'll probably lift your ribs up instead. So find a happy medium position where the shoulders are relaxing down, ribs are popping up, neck is central. And in this position, feet are parallel, in line with the knees and the hips, and I've got a generous 90 degrees at my knees. I'm going to take a soft breath in, and as you breathe out, just very gently rock back and rock forward. Make a conscious effort to keep your glutes relaxed, so we're not using the legs and the lower body, we're not pressing hard into the feet. Equally, what we do want is to feel that sensation of becoming concave and hollowing through the abdominals. So if you pop your hands on your tummy, as you breathe out, remember we empty and become hollow. Breathe in. And again, breathe out. And breathe in. So be very conscious. If you've got your hands on your tummy and as you tilt back, your abdominal wall is actually pushing outwards, you're doing exactly the opposite to what we want to be doing in this position. So just be very conscious if you need to make this much smaller, if you need to go much slower, if you need to pause me and practice, that's absolutely fine. So feel that connection in the abdominal wall. Now as we come back to neutral, pubic bone and hip bones are horizontal, close to horizontal. So just find your pubic bone, find your hip bones, and imagine you've got a spirit level resting across there. For me, I feel that I'm balanced on my sacrum. Hip bones feel roughly level. Connect the abdominals and fix that knee as if you've got a pot on your leg. As you exhale, think about lifting your right foot. Inhale, don't relax, just pop the foot down. Exhale, stay connected, think about lifting your left foot. So as we think about it, you will feel that muscular pull trying to move your pelvis from side to side. But I want you to resist that muscular pull and keep your body as still as you can. So we breathe out on the hard part, breathe in as you release. Breathe out on the hard part. Now think about that rib-hip connection. Think about keeping everything flattened, keeping the pelvis still, keeping the spine still. So this is our knee fold level 1. If you are comfortable, knee fold level 2 takes that foot off the floor. However, if you pop your fingertips on your hip bones, when you move to level 2, if all of a sudden your pelvis starts moving like a seesaw, then go back to level 1. So again, we fold. Now again, if your pelvis is moving, don't progress this exercise. If your abdominal wall is doming out, don't progress this exercise. If you experience any pain, don't progress this exercise. Only if you're quite comfortable. We come to a tabletop position, knees roughly above the hip. Imprint the spine now, flattening the abdominals as we did in the last exercise, and as you exhale, think about, don't do it, think about lifting that other foot. Take the pressure off it and release and place it down. Yeah, so again, release, not relax. Exhale, fold, imprint, connect, and think about lifting. Inhale, release, and return. Exhale, fold, imprint, connect, think about lifting. Now, only if, when you think about lifting, your abdominal wall behaves itself underneath your hands, it's not pushing outwards, then you've got the option to think about it and hover it. And return. If when you hover it, everything suddenly moves, everything gets pulled out of that position, then stay where you are, don't lift the foot. If you have a prolapse, if you have a lumbar disc injury, please don't go any further than this. If you're quite comfortable, we think about it, we hover it, and we fold. We keep the spine imprinted, we keep the abdominals connected, we lower the first leg, and we lower the second leg. So we're just going to alternate, and again we fold, imprint, and fold. Return, release, and return. One more on each side, rest if you're tired. Fold, imprint, keep that belly flat as you fold. Release, return, return. One more time. And fold, imprint, and fold. Return, release, return. Now then, from that position, knees together, and we're coming over to work the other side in our lateral position. So if your hip is uncomfortable, remember, pad under your hip. If your shoulder doesn't like this position, then place a cushion or a ball under your head. Keep the shoulders stacked either way, one above the other. And we're going to straighten both of these legs. That's where we find out if I'm going to kick my root ball. So starting with a hip hitch, stack up the body segments. If you need some support, pop your fingers on the floor. Make the waist a little bit smaller there inside the waistband. So we hitch and reach. So the top leg gets shorter and longer. And as it gets shorter, remember, we're not bending that knee. Keep it fixed. Push the heel away and hitch and reach. So my waist is flattening and hollowing. This side is hollowing and lengthening. Yeah, so I've got some movement in my hips, I've got some movement in my spine. And I'm pushing that heel away. Keep the legs stacked, and again, don't let those legs travel forward. Keep everything in a nice straight line. So this time, reach away, stay there, waist hollowed, hips and shoulders stacked. Point, lift, flex, lower. Exhale, inhale. So again, now I'm not hitching the hip. So as with our previous side, if you get tired, stop and rest. That's absolutely fine. And 4, and 3, and 2, and 1. Now as we bring those feet back together, we're going to flex both knees, keep the spine in a neutral position, keep the waist forward, flex the feet. Lift that leg for me. So remember, if you have a hip replacement, just pop a cushion between your knees so that we're not crossing the centre line with this top leg. Try and keep, if you can see in the mirror, keep that shin horizontal so we're not coming into internal or external rotation, we're just keeping it neutral. And it doesn't have to come up far above hip height, making sure that however high it comes, it's not by virtue of you rolling over backwards. We're keeping that pelvis stacked as if you've got your bottom against a wall. And 2. Now can we again rest if you're tired, if you're comfy, hold it here. So push and bend, yeah? So keep the hips stacked as that knee comes up. So what we're not doing is drawing the knee up and hitching the hip, yeah? And can we take that leg back to where it was when we were lying with both legs extended, and squeeze the glutes. So we're working these glutes, we're working the obliques, we're working the hip flexor. And 4, and 3, and 2, and getting tired. So again, as you come back in, if you've got a hip replacement, put a ball between your knees. Otherwise, you can bring the knees together, and if you're comfortable, you can drop that knee down to the floor. If you're still comfortable, then by all means, take your head down. You can have a cushion underneath your head if that's a better position for you. And if your back doesn't like this rotation, don't do it, just stay on your side. So just getting a little bit of a stretch across that hip there. Now we're going to come back into this position with the knees together, come back onto your side and come up into all fours position. And remember saying about using a ball. If you have a ball, obviously, and if you don't, you can use a cushion. We're going to come into all fours, which is very good spine stability, shoulder stability. And we're going to add a little bit of shoulder stability into it. So I'm just making sure I'm far enough back to be still in the picture. So if you think about our all fours position, hands under the shoulders, knees under the hips, and if you need a bit more loosening for your wrist, feel free to go back through what we did earlier. Hands under the shoulders, soften the elbows, press into the fingerprints and bring that weight forward if you can. Press the floor away, neutral through the lumbar spine, connect the abdominals, and remember we're not flexing through the thoracic and dropping that head, so lift the chest. Now what I'm going to do, if you can imagine from where I am, my hands are parallel, I'm going to take the ball to a position where it's at 45 degrees, not too far away, so I'm not reaching for it. All I want to do is lift my chest, keep the body still, keep the spine long, and just move that shoulder blade on the reaching arm. Keep the head up, keep the chest up, roll the ball away. I'm not bending my elbow, I'm pulling the armpit back. Inhale, exhale, inhale, exhale. Keep pressing into that supporting hand. If you're starting to get tired and your body's starting to drop, just rest. Come back into shell stretch if you need to. So I can really feel that connection under the armpit and the lats. Don't shrug the shoulder. One more time. And release. So back into my all fours position. Take that ball to 45 degrees to the right this time. My right anyway. Lift up and don't reach. Don't let the shoulder shrug. Don't let the spine move. Just roll away. Now draw down. Roll away gently, draw down. Press slightly into the ball if that's comfortable. Draw down. Try to have the ball under the heel of your hand. It will come to your fingers as it gets closer. And one more. So I'm going to take my ball out this time, whereas before I was at 45 degrees, this time at 90 degrees. Keep lifted, roll away. Now roll away and just come slightly down, follow the arm and come up and roll away and come up. I'm not bending the elbow on the supporting arm, roll away. I'm not leaning and following the ball, I'm just extending. And one more. Now I'm not going to have much room on this other side, so let's see what happens. Get that all fours position, stay really, really tall, lift up, take the ball to the side. I'm going to hit the wall, roll away, and come back up. Roll away, and come back up. 4 more. If you're getting tired, if your wrists are tired, pull back into shell stretch. And 3, and 2, and 1. And just pop your ball to one side. We're coming back onto our front again. So before we do, let's just relax that lower back a little bit. Tailbone tucks under, tailbone points up. Lovely. And again, if you need something under your hips or under your tummy, use a black pad or a cushion. And as we come down, this time we've got the feet apart. And we've got the hands in a W position and we've got the armpits drawn down. Now just focus on your W position to start with. The elbows are slightly lower than the shoulders, but I've not got them pulled in close to my body. They're still wider than the mat. The forearms are parallel, wider than the mat. Fingertips and elbows are on the floor. If your neck is uncomfortable, pop a cushion under your forehead. And if you hate this position, feel free to come out of it again. Take a breath. As you breathe out, draw those armpits down as we just did in the previous exercise. Tuck the chin, float the face. And release. So remember that this is thoracic extension, so we don't want the lower back or the lower body to move, to switch on. We want to keep them nice and relaxed. So basically my neck comes into a nice straight line and I'm unzipping from the nape of my neck towards the centre of my shoulder blades, between the shoulder blades. And I'm going to inhale as I lift up because that assists with extension. And exhale as I relax back down. If you find it uncomfortable, make it smaller. Now, that's our prep. So if you are comfortable, what we're going to do is go a little bit further and go into lumbar extension. If your lower back does not like extension, please don't do this. So we draw down, float the face. I'm not pressing into my forearms, but I am going to switch my glutes on and just come up a little bit further. And then release back down. My neck is not really changing position, it's just coming along for the ride. So my eye line drags forward towards the front edge of my mat. And I draw down, engage the glutes. I'm still getting that lovely controlled thoracic extension before the lumbar extension. So your lumbar extensors are staying relaxed and then switch on towards the end. Think about drawing the navel in so those deep abdominals are supporting your back. Engage, float up and release. One more time. So to a range where you feel comfortable and float up. Release. Now bringing my hands back, I'm going to pull back and rest in a shell stretch position. So I've got feet together. If you're comfy, you can take your knees apart, come all the way down onto your forearms. And again, think about drawing the shoulders down so we're not letting the shoulders collapse under the ears, and just take a few wide breaths. If your knees are not comfy, keep your bottom lifted in the air. One more time. And relax now, coming up. Coming into a seated position. Get myself organised. And remember, if you're not comfy seated, your option is to sit on a on a book or a pad or a cushion or whatever you've got handy, and it might well be that you find it difficult to sit up in a neutral position, in a tall position, in which case you definitely need to sit on something. For me, I just find I'd like a little bit of padding, so I'm just going to sit here. And you can cross your legs if you want to, or if your hamstring's long enough, you can bring your legs out in front of you. Either way, you can bend the knees if that's better. And I'd like you to sit tall. Think about your shoulders staying horizontal, and think about hitching your hip. So I can see myself, and for me it just looks like I'm leaning from side to side. What's actually going on is down here. So I'm hitching my right hip, hitching my left hip. Now you might remember going back to, it was probably the 1970s, you know, Kool and the gang doing oops upside your head and walking on your bottom. That's pretty much what we're doing. We're lifting that hip up and lifting that hip up. So think about that sit bone coming off the floor. Now if you're comfortable, you might be able to just travel that forward a little bit, and obviously if you're on a block you've just come off it, and go backwards. So bottom walking, which also takes me back to, I can't remember whether it was actually Jane Fonda doing this, but I remember going to a fitness class in that era and doing this. In fact, I remember doing it on the floor in the waterfront nightclub where we used to do our fitness class, and standing up with peppercorns and dried up prawns stuck to my bottom. And come back and relax there. Okay, so to finish with, we're just going to do a few little stretches. So if you're on the floor and you're near a wall or a unit, I don't know if anybody's exercising in the kitchen, you can sit back up against the wall. So your back is supported and you've got your bottom pushed right back into the corner. And if you're comfortable, bring your legs out in front of you. If it's more comfortable to do these one at a time, that's absolutely fine. So if you've got sciatica, please keep your toes pointed away from you and don't do what I'm going to do next. So we're keeping this leg as straight as you can. If you're feeling really tense and really tight and having difficulty straightening that knee, sit on another cushion, put something under your bottom to prop you up a little bit higher. If your knee is flattening right down into the floor and your foot comes off the floor, again you can put something, a rolled up towel or a cushion underneath your knee there. And all we're going to do is just point and stretch that foot a little bit. So we're mobilising the ankle, we're stretching the hamstring, back's against the wall. Lovely. And then heel stays on the floor and just roll that in and out. So I'm not just waving my foot around, my kneecap turns out, my kneecap comes in. So that's rotating the hip joint. Now you probably noticed that I can go sort of 12 o'clock and out, but that way it doesn't really happen for me. You should theoretically have an equal amount of turn in and turn out, but I've not. So come back, and again we do single leg, bottom's back in the corner, back's in a nice upright position. If it's enough for you to just be trying to get that leg straight, do that. Don't worry about trying to force any further movement. If you're happy, point and flex. And again, if you've got sciatica, keep your toes pointed away from you. So just mobilising the ankle whilst we're here, and obviously if this is giving you any neural symptoms, stop doing it straight away. And if you're comfortable with your foot flex, flex it. If you're not, keep it pointed. It's useful for me to demonstrate with my foot flex because you can see what I'm up to. I'm rotating out and in. Yeah. So imagine I'm turning my knee out and my knee in, my foot out and my foot in. You can see the medial ankle and you can't see the lateral ankle, but theoretically. And relax there. Bring the soles of your feet together. Little toes together, nice and tall, and just let your knees sink down towards the floor. And again, this is quite a strong stretch. What I'd like you to pay attention to whilst you're stretching is, are both knees at the same height? Do you feel both sit bones are resting on the floor or on your pad or whatever you're sitting on? So that we want to be balanced. Do the hips feel level? Do the shoulders feel or look level? And we want to feel that stretch right up at the top of your inner thighs here. If your knees are uncomfortable, just take your feet further forward. And relax there. Well done. Thank you very much.